And now on the line is Danielle McLaughlin. Danielle is the Director of Advocacy of Chime. Chime are the national charity for deaf and hard of hearing people. Danielle, welcome to Near FM.
Hi, Darren. Thank you.
Okay, Danielle, I have over the years done a few interviews on Near FM about vision loss, but today is my first interview with yourselves and Chime and to cover the issue of hearing loss in general. Uh, Before we talk about World Hearing Day 2025 and the main issues yourselves and Chime are currently focusing on, could you start off, Danielle, by telling me, please, a bit more about who Chime are? Because I understand that your organisation had a couple of different names in the past. Did you know?
That's true. Yes, we've gone through a few phases of names. It was previously known as Deaf Year, most recently, and we changed to Chime there in 2018. We're the national organisation for deaf and hard of hearing, and we'd be supporting close to about 25,000 clients a year. So we provide advice and support. We have 12 resource centres around the country. We also provide outreach clinics to other areas. And we have assistive technology for people to assist them in their everyday living. We deliver social groups, and we organise social groups for all ages, from children right up to adults and older persons. And other areas of support where we can, we would have a couple of residential homes, and we run a newly diagnosed weekend for parents of children with babies and toddlers newly diagnosed. So there's a range of areas that we do support with them. We have social work, and we cover all areas of hearing loss as well, such as tinnitus. So there's lots of areas that we're involved with, right across the life spectrum for people.
Sounds like you're doing huge work. Okay, we'll move on. Yesterday, Monday, the 3rd of March, was World Hearing Day 2025. Can you tell me, first of all, Danielle, how the day in general went for you and Chime and your members?
Well, in Chime, we would have lots of people who would come to us, who would be referred by their GPs or by the audiology and the hospital departments. A lot of people would get in touch with us locally, who have maybe heard about us and maybe seen some advertising and would be looking for more information.
I imagine that a lot of work by yourselves and Chime is in preparation for World Hearing Day every year, is there?
Well, every year we look at the issues that are affecting people, and so we in my role in particular, we're working towards advocating for change, equality and inclusion, and improved access for people who are deaf or hard of hearing. And this year we're highlighting the issue of the National Hearing Care Plan. This was announced by a new plan that was announced by the Minister for Health last year in August. That a new working group would be set up to develop a new National Hearing Care Plan. And that's really just to work on the issues highlighted by the World Health Organization, who are calling on countries to develop a national hearing care plan to enable that accessibility and inclusion for people who are deaf and hard of hearing. And one of the major issues that we're experiencing in Ireland at the moment is the huge, long waiting lists to access audiology treatment. So unfortunately, we know that from the figures from the department that there are over 26,000 people on the waiting list. Over half of them would be children, and then a lot of them would be waiting over a year, even up to 3 years. So we're saying that this is having a huge impact on the hearing health of a lot of people. And one example would be, if an individual is in their later years, in say 80, 81, they'd be waiting until they're 83, 84 to get that hearing appointment, which really just is far too long and is having a huge impact on people's health. As you know, with with the loss of hearing, there comes other difficulties. So it can have an impact on people's well-being and their mental health. People can feel socially isolated, feel less independent. It can cause depression in some people, and it is actually linked. Hearing loss is linked to dementia. So we know that 8% of all dementia cases can actually be traced back to hearing loss.
8%, is it?
8%, yes.
I never knew it was that high. I have heard that though, the connection between the two of them in recent years. Yeah, this is the main reason I got in touch with you for the interview. What you're talking about there about the huge or the long waiting list for audiology services, and this is public audiology service. So am I right in saying that a lot of people, if they can afford it, are going private?
That's true, yes, and there is a scheme through the treatment benefit scheme to access free hearing aids. Now, this would be through private providers, while often people will use that as an alternative whilst they're waiting for the referral to the HSE audiology department. And that's fine, and it's working for a lot of people, but they may not be getting the quality of hearing aids that they need. Now, one of the solutions that we're asking for the government to consider is to bring on board private providers of hearing aids to enable that, or to, I suppose, tackle that backlog, and to reduce the waiting list, and that would need to be done properly and with proper oversight from the HSE on the quality of their provision. So that's what the National Hearing Care the National Hearing Care Plan working group is looking at. So we're calling on the Minister to try and bring forward the findings of that working group as soon as possible.
Yeah, I think it's shocking that approximately half of the people on waiting lists are children. Like, we see it in so many different areas in the public health system, the children on waiting lists. Okay, you mentioned there, like, talking about the National Hearing Care Plan, and you mentioned one issue already that you think you would like to see published as part of it. Can you tell me more about the call of yours for a National Hearing Care Plan, and kind of like ideally what the plan would entail of if it was brought in your point of view?
Yeah, so I mean, we agree with the World Health Organization. There really does need to be early intervention, really, in preventing, the impact of hearing loss with individuals who really need care. There's unfortunately many people who go undiagnosed, and in our case in Ireland, where there is a long waiting list. There is the need where our people are feeling kind of, having no alternative but to go to private providers, and the Department of Social Protection's treatment benefit scheme is helping in some way. But a National Hearing Care Plan would really work through all of those complications and maybe duplication of services between the public and private sector. And really streamline a proper National Hearing Care Plan that really tackles the early intervention and prevention of hearing loss. There's lots of, I suppose, areas that the working plan will look at, and potential areas that they can work on to improve services for those who are deaf as well, such as improved accessibility to support and to assistive technology. So there'll be a lot, I suppose, that they'll be working through in the next year, and we are hoping to hear from them very soon on what's going to happen, and we'll hope to engage and give feedback from the community at that stage.
Okay, Danielle, it's great talking today on the RFM for the first time. Just before you go, come towards the end of the interview, in the last few weeks we have a new Minister for Health in Ireland. Based on the feedback yourselves and Chime are getting, like, is it only basically a matter of time before this new National Hearing Care Plan is published, or is there uncertainty, or like what's the story like?
So, I mean, we've written to the minister and we're asking for an update on this. I mean, as far as we were aware, the minister for health at the time, Minister Stephen Donnelly, announced that the working group would start in August. And since then, you know, we've had the general election and there has been some delays, I suppose, across all departments. So we're looking for the updates at this point, and we'd like to be informed of when the findings of the working group will be published. And we're very interested in engaging at that point.